Hello everyone. Good evening. I am Dr. Puneet and today's last topic in this stroke series, that is stroke in children. So today we will discuss about stroke in children. Actually similar to that of adult, stroke is also occur commonly in neonate and young children, and the causes may be genetic, environmental, or developmental. Now, the risk factor for this stroke in children, before going to this, actually, stroke may be because of blockage of blood vessels, that if there is a blockage of artery to the brain, that lead to infarct. And if there is a blockage of venous system, that lead to the venous infarct. And if there is a leakage of blood vessels, then it leads to hemorrhage in the parenchyma of brain. Now, risk factor for this stroke in children, actually vascular malformation. If vascular malformations are there, such as avium, aneurysm, or cavernoma, it may lead to the hemorrhage in the substance of brain, and resulting vasospasm may lead to infarct. Then deficiency of factor 8 and 9, hemophilia A and B, may lead to bleed in the brain. Certain type of anemia such as sickle cell anemia, this sickling lead to thrombosis and clot formation, and which respond to immediate exchange transfusion and then long-term therapy of with hydroxylurea to increase level of fetal hemoglobin. Okay, and then complex congenital heart diseases. They are very important cause of stroke in children. And lastly, leukemias. Due to leukostasis, there is increased chance of thrombosis. And sometime even after radiation lead to risk of stroke up to 10 years after this radiation. Okay, and then metabolic conditions such as dyslipidemia, or familial dyslipidemias, or and this hyper homocystinuria. This lead to the endothelial damage and clot formation. Okay, so when you are discussing about etiology of a stroke in children, so congenital heart diseases, even cardiac surgery and catheterization. When you put catheter, then there might be endothelial damage, and that may lead to stroke. And stroke are more common at the time of surgery. And one more risk factor is ECMO, extracorporeal membrane oxygenation. Sometime up to 28% of patient may develop 0 to 28% per patient may develop stroke after ECMO. Okay, so after this cardiac causes, hematological, actually newborn have decreased level of vitamin K in first day of his life. So decreased level of vitamin K dependent factor lead to the bleeding in the substance of brain, may lead to. So giving this vitamin K at the time of birth is very beneficial in preventing this. And then deficiency of certain kinds of protein such as protein C, protein S, antithrombin, APC resistance. So these may lead to clot formation. Some short-term conditions such as nephrotic syndrome may lead to deficient antithrombin and may lead to clot formation. And after this hematological disorder, certain trauma to the neck in a child with this collagen vascular disease or vessel wall abnormality may lead to dissection. And apart from this there are certain other causes of stroke in children. And certain other causes of stroke in children stroke are more common in boys because of high level of testosterone promote this stroke. And and uh, uh, this metabolic stroke, hyperhomocystinuria. So these metabolic stroke are more common at the time of metabolic stress. Okay, and they are non-territorial, means they don't follow any vascular territory. Okay, so they are non-territorial. This is very important point for metabolic stroke. Okay, and here in blood investigation you offer for this serum lactate and serum ammonia level, which is elevated in this mitochondrial diseases. Okay, then after all these certain kinds of lipoprotein A and certain other conditions may lead to stroke in child. Okay, some, as I already discussed, vascular malformations such as avium, aneurysm, though rare but common at carotid bifurcation or in posterior circulation, and then this avium, aneurysm, and then this cavernomas. They are important cause of stroke in children and lead to bleeding the substance of brain, and then resulting vasospasm may lead to infarct. Okay, and after all this, how the children present, actually children present with either seizure or FND. So seizure are common in these in stroke in children, and then focal neurological deficit may not be apparent in very young age, because the child start walking after 1 year of age, and a child who is just started to speak, if he is not speaking, then parents think that there is some behavioral problem is there. They don't recognize it as neurological, they recognize it as behavioral problem. So when you evaluate these patient, suppose if there is development of hand preference before 1 year of age, always suspect that there is mild hemiparesis on other side. Okay, so if hand preference generally doesn't develop within 1 year, so if it develop within 1 year, so think about stroke, mild hemiparesis. Okay, and slow development, suppose parents comes, doctor, he is 18 month or she is 18-month old, but children of her age walk normally, but she has not been able to. So slow development, they present with slow development. When you offer MRI or you order MRI, then you think that damage is there. Okay, so they among causes, you should also remember encephalitis or this meningitis. Meningitis may lead to vasculopathy and may lead to clot formation, especially after this chicken pox or HSV1 infection, or in neonate group B streptococci vertical transmission may lead to this stroke kinds of manifestation. Okay, so and beside this moya, some vascular disorder, moya, FMD, fibromuscular dysplasia, these two are important causes. And there in moya children, how they present, the very unusual type of complaint that doctor, when he cries or he hyperventilate, or my child hyperventilate, he develop hemiparesis, he develop weakness. So transient ischemic attack which is precipitated at the time of crying. Okay, so it is again an important clue. Okay, and then after this after all this, now imaging में CT is good for hemorrhage, but it might not detect ischemia up to 24 hours. So for infarct, MRI is better. DWI shows hyperintensity up to within an hour of a stroke, and it persists for up to 2 weeks. But there might be pseudo normalization within a day or two in neonate. So in case of neonate, If DWI doesn't show in children having stroke 7 days back, it generally not you can't confirm that DWI doesn't show hyperintensity, so there is no stroke. Okay, so pseudo normalization is in neonate is there. Now, treatment. How will you treat? Acute treatment, intravenous thrombolysis, if present, up to 4.5 hour. But remember, no clear guideline in children, and especially in neonate, there's low level of plasminogen. So thrombolysis should not be offered to neonate. Okay, then for venous sinus thrombosis, offer heparin to the patient, to your child. Otherwise, clot propagation, thrombus propagation may be there. And in sickle cell disease, exchange transfusion is given. And in protein C concentrate, antithrombin concentrate for these protein deficiencies states. And then finally, chronic therapies in protein C, protein S deficiencies, or this antiphospholipid antibody type of conditions, lifelong treatment with anticoagulation offer to the patient. And then suppose dissection is there, so as in adult, there is no superiority between antiplatelet or heparin. You can use either of them. And similarly, in a stroke chronic therapy, there is no superiority of heparin over this aspirin. Okay, so we generally prefer aspirin in children. Okay, now finally, suppose a child is having a stroke. So if strokes are multiple and larger damage, multiple stroke is there or larger damage is there, then children may have symptomatic epilepsies for rest of his or her life, or children might have some developmental delay, cognitive difficulties, and motor weakness might be there. So this is all about stroke in children, and this is last topic in this stroke series. Thank you very much for listening me. And actually, I prepare this whole series for my UG student, and also for PGs, and also for DM aspirants. So I hope this video will be beneficial for you in your academic life. Thank you very much.